Right. It is upon us. Medicare 2026. The new plans are out effective October 1st. And we have Ari from Chapter Medicare here today to talk about all the details for 2026. Let's make sure you get the best plan for you. How you doing, Ari?
I'm doing great, Doctor. I'm very excited to be here with you and your viewers.
Yeah, it's going to be an interesting one. I think there's something in the news about a government shutdown as well, and so we'll talk about that based on my decades of inside experience in Social Security. There's some things you can do with Social Security during a shutdown, and there's some things you can't do, and then there's some things you really need to pay attention to, or you might have some bad repercussions. So we're going to talk about that. We're going to talk about the grocery cards. We're going to talk about those Medicare Advantage plans out there, having several plans, and a big one that we really need to talk about it. I think the last estimate is close to 1 million or over 1 million people receive their annual notice of change that says, it's been nice having you as a customer, a Medicare Advantage plan. It's been nice having you a customer for the past year or 2 years or 3 years, but bye, we're canceling your plan. These are particularly PPO plans. Is that the numbers you're getting, about 1 million or so?
Yeah, it's going to be a huge number of people. Whether it touches 7 figures, I'm not positive. It's going to be a large number, though, that are losing their coverage at the end of the year, which gives them a guaranteed issue right to choose Medicare Supplement, meaning no questions about your insurability, and you can't be price discriminated against.
Perfect. That's what this is also a live Q&A, so we've got a lot of questions here. That's Paul right out of the gate. Thank you so much for that. If I want a Medicare Supplement Plan G, would I be allowed to see the doctors of my choice? Are there any co-pays involved when visiting the doctor? There's so much false information out there. Okay, so let's try to help those people, Paul, and the rest of the hundreds of thousands of people that are going to be losing their PPO plans or losing their plans. They have other options. And if your plan that you have had has been canceled because they're closing out in your particular neck of the woods, then on the letter you receive, it will show that you have what's called a guaranteed issue on that letter. So treat that letter is like the golden ticket at the Willy Wonka's chocolate factory, right? You got to keep that letter. So what can they do with that letter, Ari?
We're going to take that letter. When you share it with us, you can send it by email, you can scan it, whatever's easier. And then we are going to help you find a Medicare supplement plan through guaranteed issue, meaning we don't have to ask any questions about your insurability. And we're going to submit that letter as proof that you're entitled to purchase the Medicare supplement plan letter of your choosing. And to the question, the answer is that almost every doctor accepts Medicare nationwide, and almost every institution as well. So if you want to go to the Mayo Clinic, the Cleveland Clinic, MD Anderson, you name it, you can go there if you're on a Medicare supplement plan, because Medicare supplement uses the same network as original Medicare, and original Medicare is networkless. Unlike Medicare Advantage, where we're in the world of managed care and you're subject to HMO or PPO-like restrictions.
Yeah, I always tell people when you have a Medicare supplement, your network is America. But people said, Ed, you said I can go anywhere, but yeah, any place that takes Medicare. And then one of the things people come back and they said, but I went to this doctor I liked and they're not accepting new patients. Okay.
Yes, I'm so glad you brought that up. Yes,
Yeah.
They have to be accepting new patients.
Yes.
Yes, so, which can be a problem if you live in Northern California or somewhere where there's very few primary care doctors and they're not accepting new patients.
Yeah. So they have to be accepting new patients, or they have to really like you, really have to put on your salesman hat to convince them, yeah, I know you're not accepting new patients, but I am special. And this is why I'm special, because I'm so awesome. And I bring cupcakes every time. And I'm sure you should be able to get in, right? Okay. So there's 10 different Medicare supplement plans, 10 letters. The big ones are G, N, and F. So with that guaranteed issue, can they get any one of those?
Each Medigap plan letter type is standardized under federal law. So an insurance company can't vary on the hospital or medical benefits that they offer to you. The only question is whether original Medicare has paid its 80% share. And if the answer is yes, then the remainder is forwarded on to the Medicare Supplement insurer of your choosing. And Medicare Supplement, Medigap, synonymous terms. Dr. Ed and I just like calling it Medigap because it makes it easy to picture what it's doing. It's covering the 20% gap you'd otherwise owe. Now, on the Medigap plan letter types, the three most common are Plan F, Plan G, and Plan N. Plan G is the most comprehensive and flexible Medigap plan letter type for someone who recently turned 65. Previously, if you turned 65 before January 2020, Plan F had been the most comprehensive and flexible. Here's the thing. There is one difference between Plan F and Plan G. Plan F covers the Part B annual deductible, which is $257 for 2025. We don't know what it'll be yet for 2026, but that number will be published soon. And Dr. Ed, how excited would you be to have a $257 deductible?
That'd be pretty awesome. Yeah. And there's no limit, right? So whether your costs are to get my hair transplant, whether it's $500,000 or $1 million, there's obviously that's not covered. But anyway, there's no limit, right?
I'm about to be the bearer of bad news. A hair transplant would be an elective procedure, not covered.
Well, yeah, I got to get it out there.
But I like your hair.
But there's no limit, right?
There's your maximum out of pocket would also be $257, and you would not see a Medicare approved expense thereafter. So if you contrast that with my work provided insurance, here, my wife, daughter, and I don't see $1 of benefit until we hit our $6,000 deductible. And then we have a $12,000 maximum out of pocket. So back to Plan F and Plan G for a second. Plan F covers the Part B annual deductible, which is $257 for this year. Plan G does not. So if you're paying more in premium than $257 on the calendar year, then Plan F isn't a very good value to you compared to what you may get with Plan G. So you can actually dollarize the difference. And if you're paying more in premium than $257 for this year, then you may want to consider switching to Plan G because the coverage is otherwise identical to Plan F. Then you mentioned Plan N. Do you want to save contrasting Plan G to Plan N for a little later on, or do you want to get into it?
Yeah, let's go for it. Yep. Yeah, because that's there's a lot of people that don't know whether they need to switch.
All right. So Dr. Ed is a big fan of Plan N. And Plan N has three differences from Plan G. Under Plan N, you would have a copay of $20 when you go to the doctor. Under Plan G, you would not have a copay. The second difference is under Plan N, you would have a fee of $50 if you go to the emergency room and you aren't admitted within 24 hours. If you are admitted, the $50 will be reimbursed to you. The third difference is the biggie, and that is under Plan N, you can owe an excess charge of up to 15%, depending on the state that you live in. Now, excess charges are quite uncommon, but if you do go to a provider or an institution that would assess an excess charge, which is something our advisors have at the touch of their fingertips and can tell you whether an excess charge would be applicable, then you'd want to be on Plan G, because Plan G, the carrier can't pass that excess charge on to you. Under Plan N, they can pass on up to 15%, depending on the state you live in.
I've seen, from my personal experience, anecdotal evidence, the places that do the excess charges I found it to be kind of psychiatrists and podiatrists. Have you kind of noticed the same thing in terms of the excess charges?
There are some institutions that pass on excess charges. I won't name any names, but it really depends on where you want to go and whether your doctor does bill an excess charge. And if they do, then under Plan G or Plan F, the insurance company cannot pass that excess charge onto you. They have to eat it. So you'd want to be on a Plan F or Plan G in that instance.
Okay. And so that's here's because we're starting right now. Ari and his team or anybody out there can review your plan, talk about new plans for next year, but they can't actually enroll you. So this is actually a good time to review your plan. And if you're in the best plan, then you're done for the rest of the year. But if you're not in the best plan, then you can't actually switch until October 15th. and you have until December 7th to make that switch. And the new plan starts in January 1st. So it doesn't matter who you talk to, whether you talk to Ari and his team at Chapter there, or you talk to your brother or cousin or high school buddy that also helps people with Medicare Advantage. Here's what you need to do. I call it the 6 Ps. You need to get your current plan, and that way you're comparing apples to apples. You get your providers. You want to make sure, again, all of this is to make sure you're not making any mistakes and you're not in the wrong plan for 2026. So any providers that you need, that one family physician that you need, that one specialist that you need, the one hospital, the one clinic, make sure you have that written down. Your prescriptions, exactly the dosage, if it's a brand name, if it's a gel, it's extended release, have that available right there. If you want a particular pharmacy, or if your local pharmacy that you want to support, we like supporting our local pharmacies out there, but sometimes it's cheaper to do a mail order type of situation. And your priorities, whether you want to, your number one priority is to keep this specialist. Your number one priority is to get the most dental or vision or save as much as you can on hospitalization. And the last P is patience. If you can't change it on October 15th, it's not as though these Medicare Advantage plans, it's get them while they're hot. So, it's like the Labubu or whatever that thing is where you can't buy it anymore. It's the old, the old Beanie Baby or whatever. It's not one of those things that if you don't get it until December 7th, you're still good. Your new plan won't start until January 1st. So don't sweat it if you can't get to whoever you need to get to on October 15th. You got plenty of time, but definitely don't wait until the December 6th or 7th, the annual meeting of the Procrastinators Club, and try to get in under the wire, because a lot of people do that. So that's the important thing. Anything else you want to add on the 6 Ps there?
I love the 6 Ps. I think it's great. I'll just add that over the last 2 weeks, if you're already on Medicare, then you should have received your annual notice of change. And this will describe how your plan will operate in 2026, if it still exists. And if it is being terminated, then you have a golden ticket in order to switch to Medicare Supplement and choose a drug plan. But you need to action that change between October 15th and December 7th.
Exactly. So take a picture of that, and it's got the phone number there for Chapter there. And unfortunately, it's got Ari and I's faces on that picture that you'll take. But hey, I guess that might be an extra bonus there for you. All right. So you had mentioned a little while ago that overall terms of trends for 2026, the health insurance companies, all health insurance companies, I guess all companies are in kind of 2 modes. They're in the expansion mode, or they are in the, okay, let's go ahead and stay where we're at and try to make as much money on each particular sale or each particular customer or something. So I think you'd mentioned companies are kind of in the margin mode for 2026, right?
Yes, on the Medicare Advantage side, that certainly seems to be the case. In fact, for the very first time, it's anticipated that Medicare Advantage enrollments are actually going to drop from approximately 36 million people to somewhere south of 35, maybe even 34 million. For the first time in a couple decades, we're going to see that. It's anticipated that we'll see that.
Okay. All right. Lisa, got my ANOC 2 days ago. Not as bad as I thought it would be. Awesome. And
Yes,
Lisa,
I love that.
Yes. So you might just be in the same plan and the best plan for 2026.
Well, here's the thing. That ANOC, the annual notice of change, describes how your plan will operate for next year. It does not compare itself to any of your options. So it's probably still worth just doing an apples to apples comparison, as Dr. Ed suggested with the 6P framework. And if the plan that you were on for this year is still the best fitting plan for you for next year, that's amazing. You don't need to do anything.
Exactly. So if you're in the best plan, and you're the best plan, and remember, you're saying, oh, this is this company, I really like it, and it's the plan in this company. A lot of people don't realize the same company. I don't like mentioning company names, but the same company, your company might have 2, 3, 4, 5, 6 plans. So your plan, might be the best plan for 2026, but they're coming out with another plan for 2026. So there are multiple plans in your particular company, and that particular company. And remember, go through the 6 Ps. Make sure you get the same provider, because sometimes providers, doctors, you call them up and you talk to the front desk or the doctor and says, hey, do you take company X, Y, and Z? And they, oh yeah, we take that one. But sometimes they don't take all of the plans of that particular company. Is that right?
That's absolutely correct. Yes. Even within a given insurance company, they may offer multiple plans, and the doctor networks between that single insurance company's plans may be different plan by plan. So make sure that you're working with someone independent and unbiased who can help you evaluate every insurance company and every plan offering in your zip code.
Yep. And the reason my son and I chose Ari and his team is that we had Sarah on here a few weeks ago, and she's part of the member success team over there at Chapter. So Chapter, there's a lot of, there's thousands of people out there that can help you, find a best Medicare Advantage plan, your old buddy from high school, your nephew, son, daughter, or something like that. If they're Medicare insurance agents, that's a no-brainer. You got to go with them. But in terms of after they sign you up, there's a lot of people out there that just don't know the ins and outs. If you have a problem with billing, prior authorization, you need to find a doctor. Sarah told me that I heard it before, but I forgot about it, that if you lose your doctor and you can't find one, you call Sarah and her team, member success team at Chapter there, and they'll find you a doctor. And she says, oh yeah, we'll schedule an appointment for you too. And I'm like, wow, you actually schedule an appointment for people too. I thought that was pretty awesome.
Yeah, it's incredible what Sarah and the member advocates do to support our members. If you misplace your ID card, we'll help you get another. If you have a question about a claims invoice that you receive from your doctor, we'll help you decipher it. If you're charged an outrageous copay at the pharmacy, we'll call and fight on your behalf. You don't have to deal with the insurance company. That's for us. We'll handle the insurance company for you. So you just have to call Sarah and the member advocate team, and they will fight for you until the end of the earth.
That's awesome. That's awesome. And then actually one of the things that we want to do is, fraud, waste, and abuse and everything. That's one of the big things. Elon Musk and Doge for Social Security didn't find anything, made a lot of allegations, but didn't find anything. The people that find fraud, waste, and abuse in Medicare, Medicaid, Social Security are all y'all, as we used to say in Texas. That's the plural form of you, all y'all. And so you get a letter like that and you don't understand it, and there's upcoding and double billing and stuff like that. So we'll have Sarah back once this whole craziness is over, and we'll have her show us how to watch out for fraudulent charges, because that cost us all money. So we appreciate everything y'all do there. All right, what is I did a video a few days ago on the grocery card. So a lot of people are going to be losing their grocery cards for 2026. That particular program is going away December 31st of this year. There's another program that the card is a lot less, and you have to jump through some more hoops. You have to be chronic, and there's 2 or 3 other categories. So I talked about that a few days ago. But so if you've got your ANOC and your grocery card has been canceled or cut back significantly, then you definitely need to check if there's anything else available in your area. A lot of people really depend on that. And in terms of the shutdown, let's talk about the shutdown. Anything interesting in terms of Chapter helping people out during the shutdown? Are y'all going to have any issues?
Well, Dr. Ed, the shutdown can result in delays to people getting their red, white, and blue card. So for those of you who are approaching 65, or someone who's retiring at the end of the year and is past age 65, let's just make sure that all your paperwork is in order, so that way we can get it to the Social Security Administration. And the best way to do it is through your online Social Security account. It's fast, safe, and secure. It takes less than 5 minutes to apply to enroll in Medicare. And that will be the quickest way to get you your red, white, and blue card. Contrast that to calling the Social Security Administration's call center, where you'll wait on hold for over 90 minutes. It could be upwards of 3 hours by next week with the shutdown, and they will not help you on that call apply to enroll in Medicare.
Yeah. All right. So here's the tricks. Based on me working inside the agency, someone just says that I'm not losing my plan, but I am losing my mind. So yeah.
Yep.
Wow. Yeah, it's crazy. It's way more complicated than any of this should be. All right. So in terms of a shutdown for Social Security, for those new, my regular community knows what's going on here, but for those people that are newly joining us, Social Security, the checks still go out and everything like that. There
Yes.
are no services. If you need a replacement Social Security card, you can't get it during a shutdown. If you need a work history for like a background check, mortgage, or you're applying for the Metro Police or something like that, you can't get it during a shutdown. There's extenuating circumstances. If you plead your case that says, hey, I need the Social Security cards and I'm about to get a job. If I don't get the job, I'm going to be homeless and not have, then they'll do it. There are exceptions, but generally those workloads are not done during a shutdown. In terms of Medicare, as Ari points out, everything else takes place, but it's important that you really be preemptive. Because in terms of like Medicare, if you know you're going to be losing your job in a month or 2 months or 3 months, then you're good. Just go ahead and apply. I've got on my website, mygovexpert.com, the forms that you need, a 40B and the 564. You can go on to ssa.gov and print those off, and you send those into Social Security. If you've got plenty of time, should be no problem whatsoever. They should be able to process your application, that special enrollment period for Medicare, or sign you up for Medicare for the first part. But if something happens and you lose your health coverage and you need to start it immediately within the next week or 2 weeks or 3 weeks, then you need to go down to a local office. You can, fax it in. There's an upload button on ssa.gov where you can upload it, and that gets the documents to Social Security. But that's where the problems start, is because there's very few staff at Social Security, and it's all going to be crazy now. So your documents are there. It's in a paperless system, which I actually helped to design. It's in the system, but there actually has to be a human being that grabs your documents out of the system and actually puts them into this, adjudicates that decision. And that might take a month or 2 months or 3 months, and then you're out of Medicare for that amount of time. So if you don't have time, you need to sign up for something immediately, then you have to go down to your local Social Security office, schedule an appointment. Even that, if you can't get in, if your appointment won't be for a month or two, if you need something, you go down to the local Social Security office and you say, well, my Social Security office, they only accept appointments. Here's what you do. The guards, which those are the people that are going to stop you from coming in the office. They are not Social Security employees. They're FPS, Federal Protective Services. They're contracted. Different companies throughout the country contract with Federal Protective Services to guard the buildings. So they're not Social Security employees, but they have certain keywords that they watch out for: dire need, homeless, a PR issue. You're going to contact the news if you don't get help. You're going to contact your politician if you don't get help, those type of things. So if you tell them, hey, I need health insurance, I need my prescriptions next week or 2 weeks from now, and if I don't get this done, I'm going to lose my prescriptions, and then your Social Security and everybody's going to be in big trouble, because I'm going to be in big trouble, and I'm going to push it onto you. And they should allow you into the office. You take your forms there, and they start your Medicare immediately. Get you your Medicare SEP, special enrollment period. Your Medicare card will be in the mail. Ari and your team are usually able to see people's Medicare numbers before they get the card, correct?
Yes. With your permission, we have a system we can use in order to check the status of your Medicare, so you don't have to wait on the snail mail for your red, white, and blue card to arrive.
Okay, perfect. So if you go there and apply, if you watch the employee hand them over your forms, and they tell them, could you please just go ahead and put it in the system right now? And it only takes 10, 15 seconds to put it in the system. So you just watch them push on the system, press enter, and then it's done. It updates through Medicare probably within 24, 48 hours. And then probably within a day or so after that, they will generate the Medicare number. And then they'll start sending it in the mail, which will take another week or 10 days. But after that, Ari and his team or any other Medicare insurance agent who has access to that system should be able to go in there and find your Medicare number. And that's what they need to do everything else, correct?
Yes, it's a system created by the Center for Medicare Services. So it's a completely legit system that they have created in order for us to be able to check the status of your Medicare.
Okay, so now you've got the tricks, and here's another trick. If, as Ari points out, that if you call the 1-800 number and you're on, sometimes people get super lucky and get in a few minutes, and if you're one of those people, then you need to head down the lottery and try that one too. But if it takes you hours to get through, or they keep hanging up, or the thing nowadays is AI picks up and just answers the same question over and over and over, it's so annoying. The trick is that there's over 1,200 offices, Social Security offices in the country. And every one of those buildings has a big sign out front that says Social Security Administration. So every one of those 1,200 offices throughout the country is your office. So if you can't get into your local office, a call, through the phone, call any other office in the country and say, hey, I need help. And they'll say, we're not your office. And then you say, does the building say Social Security? It says, well, then you are my office. So that if you have a pending claim that your local office has the paperwork, then you have to do it. But if it's something new, like changing your address or getting a new Medicare card or signing up for this, that, and the other, then any office is your office. So take advantage of that little trick there.
Can we address some listener questions? There's some great ones.
Absolutely. Let's do it.
All right. Christy asks, oh, you pulled one up.
Go ahead. What does Christy ask?
Christy said that she has Medicare and Tricare for life and wanted to know if she needs to do anything. And the answer is no. You have done what you need to do. If you're a retired service member or your spouse is, meaning they served our country for 20 years or more and retired with the military, first, thank you for your service. Second, all that you need to do is sign up for Medicare Part B, which takes less than 5 minutes to do if you have an online Social Security account. And then you receive a $0 Medicare Supplement plan as a thank you for your service. And you also receive prescription drug coverage. And we wouldn't want to touch that.
Perfect. Yeah, there's a lot of Medicare insurance agents that, try to do a Medicare Advantage or something. But yeah, it's too much of a, Mary asked, my Medicare supplement said price was $180 a month in late December, and then in late March raised the price by $40 a month. Couldn't believe it. Is this legal? Number one is, why do they do that? They should, if they're going to raise the Medicare supplement plan prices, they should do it like right now so you can prepare for the annual enrollment period, right? It seems, but yeah, why do they wait until March to update it? And what can she do?
So it depends on the state. So in this state, it must have been the case that the insurance regulator approves the pricing increase in March, and that's when it goes into effect from March to March. And so there'll be another price increase next March, probably in this state. So it depends on the state that we're in and when the insurance regulator allows the insurance carriers to petition for a premium increase, which they tend to do every year. So what can Mary do? Well, Mary can shop her Medicare supplement plan at any time. In 46 states, you may have to answer a few questions about your recent health history. And if you're healthy enough, then you can switch to another Medicare supplement plan. And again, Medigap Plan Letter G is standardized under federal law. So what the insurance companies are primarily competing on is price. And it's not just the upfront price, it's also the price over the long haul. Because if you're turning 65 today, you're making a 30 to 35 year purchasing decision. That's how long actuarial tables suggest that you'll live. You have a 50-50 shot of living to 100 if you're turning 65 today. So we want to take not just today's pricing information into account, but also pricing expectations over the long haul. And that's something that our advisors have at the touch of their fingertips through our sum of premium index, which provides a basis for comparing different insurance companies that offer the same product. Because again, each Medigap plan letter type is standardized. Now, what I also want to mention here is that there are over a dozen states that now offer an opportunity for you to change your Medicare supplement plan without any questions about your health history. Dr. Ed actually has a list of those states on his website. And it's going to just depend on the state that you live in, Mary. If your state has an anniversary rule or a birthday rule, that will allow you to switch to a different Medicare supplement plan without questions about your recent health history.
Yeah, I see a lot of people getting their Medicare supplement plan, GN, or whatever the case may be, based on the lowest bidder, which, it's a great way to shop, obviously, but you have to look at the long term. Medicare Advantage plans, they're only good for 1 year. They all essentially, sunset Cinderella story on December 31st. If you don't do anything, then it renews, but it's based on different details. Medicare supplement plan, once you get it, yeah, people keep it for decades and decades and decades. So if you're, lower East Texas firefighters fund Medicare supplement plan, whatever the case may be, they kind of come out, oh, that's a super, super cheap price. And then Ari and his team, oh yeah, it's like half the price as everybody else. But next year they have a tendency to kind of really, really increase to try to get that money back. So yeah, it's very important that you look at the long term for that. And since we're talking about Medicare supplements, Spitfire Red asks about Part D. With a Medicare supplement plan, there is no Part D in that plan, correct?
That's correct. So the way that we train our team here at Chapter is marry your Medigap, date your drug plan. The time to marry your Medigap is when you first start Medicare. And as Dr. Ed mentioned, you're making a long haul purchasing decision. You're making a 30 to 35 year purchasing decision with the Medigap plan that you choose. Of course, you can change it if you're healthy enough. And there are 4 states that allow year-round guaranteed issue. They're all along the Northern Atlantic seaboard. New York, Connecticut, Massachusetts, and Maine are the 4 states that have year-round guaranteed issue. But if you don't live in one of those 4 states, then you'll probably have to answer questions about your recent health history if you're not in your Medigap open enrollment period, which is your golden ticket to choose a Medicare supplement plan without questions about your insurability. Now, every year we want to help you date your drug plan. So marry your Medigap. You just need to keep paying your premiums and the coverage continues. Date your drug plan. The time for dating your drug plan is the fall during the annual enrollment period between October 15th and December 7th.
Okay, so yeah, so that's not out, and people say, well, I don't take prescription drugs, so I won't get a Part D plan. Okay, that's fine if you never are going to take prescription drugs, because if you don't sign up when you're supposed to, then when you do sign up in the future, then you're going to get a penalty. It was at 1% for every month you did not have Part D, the drug plan, when you were supposed to get it, correct?
Yes, and that penalty continues to compound, and it's a lifetime penalty. So even if you don't take any prescriptions, it's advisable to strongly consider signing up for a Part D plan, because you can only get Medicare Part D through a private insurance company. And the 2 ways to do it are through a standalone prescription drug plan or a Medicare Advantage prescription drug plan. Those are the 2 ways to get Part D, and it's one or the other.
Okay, perfect. And so you can change those. Yeah. So if you're not taking prescription drugs, you just look at the one with the cheapest, monthly premium. And then next year, the year after, you start getting more medications. And then you kind of focus on, deductibles and co-insurance and tiers and all the rest of that stuff. Polly Pocket asks, please discuss the options for members losing DSNP. So those are the dual special needs plans before and after the annual enrollment period. Thanks a billion, Dr. Ed, Mr. Ari. So yeah, with close to $1 trillion cut from Medicaid, states are going to start really making it difficult to get Medicaid and continue to get Medicaid. Even those people that are eligible for that, they're going to, they've always put up roadblocks, but the roadblocks are going to get higher and more difficult to navigate. So what are people's options when they lose their DSNP?
If you're losing your Medicaid, it's very important for you to consider your options for additional coverage, because your dual special needs plan had been providing your Medicare and Medicaid benefits. But in order to be on most dual special needs plans, you need to be eligible for Medicaid. So if you lose your Medicaid eligibility, then we would want to show you your options for additional coverage, and so that you have that 20% covered, right? Original Medicare only covers 80% of your medical expenses. If you have Medicaid, then that covers the 20%. But if you're losing Medicaid, then we need to talk about your options for what you're going to do to insure against the 20% you'd otherwise owe out of pocket, and so that you have prescription coverage. Now, applying for extra help, Part D extra help, would still be advisable. Many people have Part D extra help, even if they don't qualify for full Medicaid. So that will help on the prescription side. But we certainly want to help you evaluate, if you're losing Medicaid, between whether you can afford a Medicare Supplement plan or your options for a standard Medicare Advantage prescription drug plan.
Yeah. In terms of switching, if you have Medicaid, a dual plan, so you have your dual, you have Medicare and Medicaid. Previously, you could switch every quarter. Is that still going to be the same for 2026?
Now it's actually become a monthly switching opportunity, but it is more limited in the sense that there are only certain plans that you can switch to. And that went into effect at the beginning of this year, actually. I should say April. It began in April, truly.
Yeah. Increasing cost of everything will cause more seniors living on the edge in 2025 to go over the edge in 2026, right into homelessness. Yes. Yeah, it's tough out there. So that's why we've got Ari and his team trying to save you all much money in terms of Medicare and everything. And then me and our community help people on a daily basis with all things Social Security and all the rest of it. So we just have to keep doing as much as we possibly can. Used chapter last year, right? Do I need to update again, even though I'm happy with my plan I currently have?
We're going to proactively reach out to you. We reached out to many members today, actually, to talk about what you can expect as the annual enrollment period begins on October 15th. And if you're happy with what you have, then it's just important to do a very quick review of your coverage. And if you're on a Medigap plan, you just keep paying your premiums, and then we'll help you shop your drug plan to make sure that it's optimal for you. And there are some exciting regulatory changes that are going into effect for 2026. So we want to make sure that you take advantage of those. On the Medicare Advantage side, we want to go over your 6 Ps. And thank you, Dr. Ed, for putting that up. So
and it doesn't matter who you contact, chapter or anybody. Remember, you paid into all those decades, you paid into Medicare through FICA, the payroll tax. This is your money. Some company out there has your money. You pay the $185. You pay taxes. That's how all these companies get that money. Then they come around and say, oh, look, we're going to provide you this. Aren't we such nice people? Yeah, they're giving our money back. So the important thing is, and you're also getting help to get that money back, like people calling chapter or any place out there. You've already paid for that help, so use it. So it doesn't matter who you contact.
There's no charge to work with a Medicare advisor, and an insurance company can't entice you with a lower price than what your insurance agent can offer. The important thing is that you're working with someone independent and unbiased. And the question there is, how are they helping you evaluate all their plans and all your plan options, and how do they create a fiduciary-like standard for you? Our CEO actually testified in front of the Senate last fall on how in the Medicare industry, there is no fiduciary-like standard to act in your best interest, which is a shame. And since day one at Chapter 6 years ago, we have worked every day to act in your best interest. And that will always be true.
Yeah, I showed that video a couple of times of him testifying in front of Congress. Hopefully they make that change. Yeah, Dr. Oz is in charge of Congress now, or excuse me, in charge of CMS. Well, anyway, a Freudian slip there maybe. And he's a big fan of Medicare Advantage plans. And, it really depends on your particular situation. But the most important thing is to check out all your options. Medicare Supplement plans, check those out. Chapter will go over all those with you. Check out your Medicare Advantage. Check out the prescription drug plan if you're going to get a Medicare Supplement. So yeah, make sure, again, you paid for every single thing you're going to get So make sure you do the right thing and ask all those questions. Let's see. Do you see any other questions?
Oh yeah, there are.
If I like my Medicare and the Medicare savings plan, do I need to do anything or just renew with Medicaid when it's time? Also, is there any OTC card for my coverage? Okay, so the Medicare savings plan, thank you for always, forever, for life. The Medicare savings plan, that is the plans that if you are eligible for Medicaid from the state, and each state, sometimes states call it different, Medi-Cal or Denali Care or whatever, but it's all Medicaid. If you're eligible for Medicaid, the higher levels of Medicaid, then they put you in a plan called MSP, Medicare Savings Plan. And it basically pays for your $185, the Medicare Part B premium. So it's a beautiful thing. So for her, does she need to do anything? And not in terms of renewing Medicaid unless they reach out to her, right?
Yeah, that was something I wanted to clarify with you, Dr. Ed, and with Always Forever for Life. If Medicaid has reached out to you about some type of renewal or some type of notice, then you absolutely want to respond to that immediately to make sure that your Medicaid will continue. Sometimes it's something like you moved and they're just trying to update your address on file. So definitely if your state Medicaid office has reached out to you, you certainly want to respond ASAP to whatever they sent to you. And that's certainly something that we can help with as well if you have any questions about a notice you've received from Medicaid. In terms of your OTC card, there are going to be significant changes to some over-the-counter programs, and that should be spelled out in the annual notice of change that you received over the last 2 weeks. And then we would want to compare that to all your other options and make sure that you're actually using your OTC benefits, because billions of dollars of OTC goes unused.
Yeah. Yeah, that was another thing I was going to add, where the previous person said, hey, if I'm happy with my plan, I know I'm happy with my plan, I'm not going to change it, I don't need to do anything else. And I was going to add in there, yes, you do, because your plan that you currently have, the Medicare Advantage plan, expires December 31st, and you've decided to renew it based on the new terms and conditions and details and, costs and everything like that. So you're going to stay with that. That's perfect. Awesome. Great. You did what health insurance companies don't want you to do. You actually looked. But you still have to do something. And that is look at your current plan and see if there's any money still on the table. If you have any dental there or vision or whatever the case may be, that also expires December 31st. So you might have some glasses that you can get. Then go get them by December 31st, because if you don't, that money goes away. Same thing with dental and a bunch of other stuff too, right?
Yes, very true. For over-the-counter benefits, they typically are quarterly, and some insurance companies don't roll over their OTC benefits quarter to quarter. So if you don't use all your OTC credit at the end of, for example, we just had a quarter end yesterday, then you have lost out on something that you signed up for when choosing that coverage, and that money goes unused. And so much OTC benefit goes unused. And if you're curious how much OTC benefit your plan offers, you can just go to myotc.com and we can show you how much OTC benefit is offered by the plan that you're on. myotc.com.
Yeah, that's it. Yeah. Someone asked, what's OTC? Over the counter. So it's over the counter type prescriptions and well, it's not prescriptions because that's over the counter. So it's over the counter
vitamins,
type stuff.
bandages, first aid kits.
Right. Okay, perfect. And remember, you paid for every penny of that. So whatever they give you, $100, $200, $300 for whatever food card, electricity, OTC, whatever it is, these people aren't giving it to you because they're super, super nice and altruistic. That's money. You're getting it back. So go out there and get it. Deborah never got her ANOC. So the annual notice of change that explains what her Medicare Advantage and everything. And someone asked, do Medicare supplement plans get an ANOC?
So the annual notice of change is typically provided for Medicare Advantage plans and your standalone prescription drug plan. Because for Medigap is standardized under federal law, And the only thing you need to do is keep paying your premium for that coverage to continue. Now, of course, your premium can go up. It typically does year over year, as one viewer noted, with her premium going up $40 for next year per month. But the annual notice of change is typically for Medicare Advantage plans or for a standalone prescription drug plan.
Okay, so everybody was supposed to get it by September 30th.
Yes.
What if, like Deborah, you didn't get it?
Well, we got to get it for you. You should have received it during the third week of September. And so now we're in October, and we definitely want to get your annual notice of change. And we will help you get your annual notice of change if you give us a call. And we'll also help you do a comparison between what your plan offers and what the competition may offer based on your 6 Ps.
So as of today, October 1st, then you can go in there officially, because the plans aren't released until October 1st. So nobody out there can give you any information on new plans for 2026 until today. And so today's today. So yeah, if you reach out to Chapter, and if you didn't get your ANOC, they're one option to give them a call, and they will have your plan for 2026. So you do the 3 Ps. The most important one in this particular case is have your current plan, so they know, oh, okay, you didn't get your ANOC, no problem. What's your current plan? And they'll look it up and they'll say, okay, here's your plan. It was, this is $100 a night for hospitals this year, but next year it's going up to $300. This prescription is going up. And so they'll be able to compare everything for you. And remember, it all free of charge, because you essentially paid for it ahead of time, right? Someone noticed that Chapter sent her a text or reached out to her and said that she had signed up last year. And so they said, hey, we'll contact you and make sure you're all set. So she loves that y'all reached out to her. And remember, Chapter will only reach out to you if you ask them. If you say, Ed, tell Ari and his team to reach out to me, call me. No. Ari would never do that. I would never do that, because you can't. But there's a lot of companies and Medicare insurance agents out there that will cold call you, and you're going to start getting the calls. If you didn't tell them to call you, or the company they work for, if you didn't tell them to call you, then they're not supposed to call you. And they're doing things. I don't know if it's illegal. It's definitely against regulation, and they can lose their license. And I don't think that's the type of people you want to do business with, that are, doing things very, very sketchy like that. Correct?
If you're receiving an unsolicited phone call, a spam text message, that's illegal. You have to give your permission to be contacted. You have to affirmatively give your permission. Now, some of you are also receiving direct mailers, especially if you're turning 65 or you're coming off work provided coverage. And just make sure that you're working with someone who's independent and unbiased, not someone who's captive to a single insurance company.
Okay, so what does that mean? So captive, it's I always say it's the old Henry Ford thing. If you can have any color of car you want, as long as it's black, right?
That's right. If you go to a Ford dealership, what are you getting?
You're getting a Ford. Exactly. So that's basically the same thing with anything else. If you go to a Medicare insurance agent that is captive, that works for Medicare insurance company X, Y, and Z, then guess what? That's what you're going to get. A broker and Chapter, they're all brokers. They don't work for any health insurance company. They work for who?
We work for you. And we have every insurance company and every plan at the touch of our fingertips, sortable based on your providers, your prescriptions, and your priorities. And then in a one-on-one conversation with you, which typically lasts about 45 minutes, we're going to provide a short list of options for you to consider, and then discuss the pros and cons, help you submit all the paperwork, and then provide year-round ongoing support through Sarah and our member advocate team.
Perfect. Sarah was awesome. Wow. This is my grocery cart is actually going up from $336 to $395. I definitely rely on it for my groceries. Wow, I think that's the first I heard someone's card is actually going up. So that's a beautiful
That's great
thing.
news. What's cooking in Nashville? That's great news.
Yeah. So, oh yeah, I guess yeah. I was about to guess maybe it was Florida or something like that, but they put the actual city down there. So Tennessee, huh? Interesting. The shutdown is because okay, yeah, we don't want to get into that. Let's see here. Zippy, my ANOC came to me email. Are they sending out those email nowadays? They're supposed to do snail mail, right?
I believe it's supposed to be mailed to you unless you selected email as your preference for delivery.
Yeah, that's one thing a lot of people are talking about recently is they get the from Medicare, they get the big book Medicare and You 2026, and people say,
Digital
"Oh my gosh,
copy.
how much?" Yeah, yeah, the paper copy. We used to order about 1,000 of those every year for our office, and yeah, we'd always have to order another 1,000 because people love those paper copies. But a lot of people don't, and I think you can opt out of the paper one, save taxpayer money is a lot of money.
Save
So
trees.
yeah. And he has a appointment with chapter. Awesome. So Zippy looks like had that option.
There are some great questions coming in.
Let's see. Someone lost their OBGYN or something that it's doctors. So if you have a Medicare Advantage plan, you have networks. And someone asked what happened to the PPO plans. We'll talk about that one before I forget. But in terms of networks, if you have a Medicare Advantage plan, and the reason you chose that particular Medicare Advantage plan is because it has your primary care doctor or it has your specialist that you have to have. You keep that Medicare Advantage plan for the entire year. They're for the entire year unless you move or something like that. But do the doctors have to accept those Medicare Advantage plans for the entire year?
No, the doctor can choose to stop accepting the plan even mid-year. The insurance company can drop one of your providers mid-year. So Medicare Advantage networks not only can change year over year, they can even change mid-year.
Yeah. And so if you lose your doctor, your specialist, you're in some type of treatment and you see the specialist and you're depending on that specialist to be a network, and all of a sudden the specialist or the health insurance company, they decide to get a divorce. You unfortunately really can't do anything, right?
Well, we've been pushing for Medicare to create a special election period when you lose a provider mid-year to allow you to change your plan. And that will be important to someone who relies on choosing a given Medicare Advantage plan based on their current list of doctors. If your doctor or the plan stops allowing you to go to that trusted provider, we want to be able to help you switch to a different plan, or for Medicare to help you switch.
Oh, okay. So y'all are actively going out there and trying to get that switched in Washington, through CMS?
Absolutely. Absolutely. It's
Oh,
very
okay.
important. Yes.
Wow. That's awesome. Oh, okay. Good deal. So,
Yeah, it's part of our continuing advocacy to make Medicare better for the people who are on it. That said, if you don't want to deal with your doctor networks changing, then consider Medicare Supplement because original Medicare is networkless.
right. So for those people that, are interested in that, we've got hundreds of thousands of people out there in our community. You might have to contact your politicians, and that is definitely a good thing to add in there. So reach out and say, hey, people that lose their primary or their specialist mid-year, they should have a separate option. So I think that's a definite number two right after hair transplants. But yeah, anyway, we'll go there. Plan G participants do not get an annual notice of change. Correct. This document is only Medicare Advantage and Part D prescription drug. Yep, Danny is right. The only thing you will get if you have a Plan G is the bill saying how much your plan is going to go up for the following year, right?
Well, that doesn't necessarily happen at the end of the calendar year. It depends on the state that you live in. One person, they have a change that went into effect in March. In many states, it's actually July. It just depends on what time of year the state regulator approves the insurance company's premium increase for the given Medigap plan letter type that you're on. And insurance companies do need to petition the state regulator to increase premium typically.
Yeah, those Medicare Advantage is regulated nationwide through CMS. Medicare Supplements, kind of a federalist type system, but in terms of enrollment periods and a lot of that stuff, they are controlled, regulated by the particular states, right?
Yeah, even though it's standardized, each Medigap plan letter type is standardized under federal law. Medicare Supplement is regulated state by state. And that's why some states, for example, have an anniversary rule or a birthday rule, which creates a switching opportunity for you to adjust your coverage without questions about your recent health history.
Okay, perfect. Bonnie, it is important to read the ANOC as it does change yearly on an advanced plan, Advantage plan, I guess. Mine went up urgent care $10 to $65. Going to talk with chapter. You cannot get into the doctor right away. Yeah, a lot of people, when they get their ANOC, they just say, is my doctor still going to be there? Is it still zero premium? And then they just stop there. And I understand it's the rest of the stuff is complicated and you don't know whether you're going to need it and you don't care about a hospitalization. Oh yeah, it's going up. It's not, if I have to go to a hospital, it's not $100. It's going to be $300 a night. This is going to cost more, but I don't need that now. So forget about it. I understand we're all very, very busy, but it takes, what do you say, about 45 minutes to review your plan and see if there's anything better out there?
It takes 15 minutes to assess whether your plan is going to be optimal for you for the upcoming year. And that's true. Again, marry your Medigap, date your drug plan. And if you're on Medicare Advantage, the time to date is every fall between October 15th and December 7th.
All right. And it's even quicker if you're prepared with the 6 Ps, right?
Yes, absolutely. Yes. Please go over your annual notice of change and then write out your 6 Ps and then schedule your free Medicare consultation.
Exactly. Steve, will it change in states that have made cuts to state budget for Medicare?
Medicaid.
Yeah, or Medicaid. Yes, did I read that? Okay, thank you. For Medicaid. Medicare is a federal system, so the states really don't have an issue in there. Medicaid is again a federalist system. It's the large parameters are put down by the federal government, Center for Medicare and Medicaid Services, but states have a lot of flexibility to do different stuff. And as you saw, we're looking at close to about $1 trillion over 10 years cutting from Medicaid. That's not going to begin for a little while, but federally, it's not going to begin federally for a little while, but states, most states in their constitution, it says we have to balance our budget. And they look at their budget for next year and 2 years. So the states actually kind of do like everybody else does, unlike the federal government that, anyway, we won't go there. But states look at the future and they say, hey, it looks like we're going to get, tens of millions of dollars or hundreds of millions of dollars less next year or the year after. Let's start doing something now. Correct?
Potentially.
It
depends on Medicaid is again, state by state. And so each state has a little bit different parameters as to what is the cutoff for Medicaid. And it's going to depend on the state that you live in, what your state's cutoff is and whether you qualify. And again, if you receive a notice from your state Medicaid agency that is code red, it has to be addressed because we don't want you to lose your Medicaid. And if you are losing your Medicaid, then we certainly want to discuss your options for additional coverage to make sure that you have insurance for the 20% you otherwise owe out of pocket, because you're going to go back to having original Medicare. And that means you'll only have 80% of your medical services covered.
Keep smiling. I got mad and told my Advantage I need to see other plans, not just my current plan change. Can we go over them or can you send me a pamphlet? He said, no. Then he said, Medicare has that and just hung up. Yeah. So it sounds like you were trying to do the right thing and shop for other options out there. And your Medicare insurance company just not interested. Again, it sounds like it's a captive agent type stuff. Well, if you wanted the.
Oh, yes, please.
Go ahead.
That is just an awful experience. Keep
Yeah.
smiling. That is terrible service. And really, you could go to Medicare.gov and hopefully see different plan options available to you. If you want to go over whether the plan that you're considering accepts your doctor's drugs and meets your priorities, though, then we'd be delighted to help you and perhaps give you a second opinion.
Okay. Diana asks, is everything in the new 2026 booklet we just received? Yeah, everything for original Medicare Part A and Part B. It talks about what a Medicare supplement is, what a Medicare Advantage plan is, what Part D, but it doesn't go into, what Medicare supplement plan is best for you, which companies are available in your particular area, how much they are, and same thing with Medicare Advantage. It's a good start, but it doesn't get you there, correct?
Yeah. So my mother-in-law just started Medicare, actually. Her Medicare started today. And I was surprised. The booklet is very, very short, Dr. Ed, very short. The pamphlet that I think Diana is referring to. And I was surprised it didn't cover a lot of the exciting regulatory changes that are going into effect. So may I summarize those briefly?
Yeah, absolutely. Please, please.
So there are three major improvements on the way to Medicare Part D. The first is that there's going to be a maximum out-of-pocket cap of $2,100 on your prescription costs. In order to have your prescriptions be subject to that $2,100 cap, though, each of the medications you take need to be covered under the prescription drug plan of your choosing. So very important to review your prescriptions. The second change is that previously, if you'd gone to the pharmacy for the first time to fill an expensive brand name medication or a specialty medication, you could have owed thousands of dollars upfront when you first filled that medication. Now, the prescription drug insurers are going to automatically apply smoothing. So if you're on a standalone Part D plan, or if you're on a Medicare Advantage prescription drug plan, and it covers the drug, the expensive medication that you're getting filled at the pharmacy, then they're going to apply smoothing over the course of the year. And remember, the maximum out of pocket is $2,100. So if your drug is subject to that maximum out of pocket, you'll owe a little less than $200 for that expensive prescription or multiple prescriptions.
And then that's automatic for 2026?
Yes, it's going to be, that smoothing is going to be automatic for 2026, and it'll start January 1st.
Awesome.
The third change is that there's Medicare price negotiations that are going into effect on a list of 10 drugs. If you take one of those 10 drugs, you should see a lot lower costs for next year. Good
deal. Good deal. So yeah, the max out of pocket for Part D was $2,000. It just went up $100 for next year. And this year, the smoothing, you actually had to ask for it, right?
Smoothing for this year, you had to affirmatively enroll in the pro for 2025, but for next year, it's now going to be automatic, which is a good change.
Perfect. Right. Yeah. Awesome. So basically smoothing, it's if your drug, let's say it's, you have to pay $2,000 and your drug, Bella just said her drug was $22,000. Normally $2,000, your max is $2,000, but in January, you got to pay us $2,000. And then the smoothing is, okay, you don't have to pay us $2,000 in January. We'll smooth it for the entire year. So you'll pay a little bit until you get to $2,000, right?
Yeah. And for next year, it's going to be $2,100. So it's going up.
$2,100.
Yeah.
Perfect. What are the hours of chapter?
Great question. Starting October 15th, our hours are going to be Monday through Friday, 8 a.m. Eastern to 10 p.m. Eastern. And then on Saturday and Sunday, 9 a.m. Eastern to 9 p.m. Eastern, starting October 15th.
Okay. And then on December 8th, put you in a chamber, one of those
hyperbaric chamber.
Water. Yeah, the hyperbaric or the sensory deprivation chamber or something like that until January 1st again or something, right?
I'll take that one to the team. We'll see.
Yeah, all right. All right. Is anything, let's see here. Any other questions that you want to pick out? Anything else you want to end with there, Ari? We're definitely going to have you back again during this very, very interesting season to make sure everybody gets everything they're eligible for and they paid in for. Anything else you want to add?
We're just getting a lot of love in the comments. I'm taking it all in. Thank you to you have such a following, Dr. Ed, and so it's wonderful to see some familiar faces.
Yeah, we've got some great people and they help other people. Yeah, every single day. And people come in and they're stressed out, and everybody just kind of jumps on those people and said, "Don't worry about it. We got your back." And yeah, so we've got the best community on the internet. I would 100% agree. So a lot of people out there that are hurting, struggling, and having to deal with the bureaucracy. It's just too much. So any place, anybody that can help out, it's a beautiful thing. And Ari, we really, really appreciate you coming in here on the very first day and helping us out and going through all those nightmares. So if you need any help with Ari and his team, definitely reach out to them. You had
Can
something
we
else?
end real quick with Lori's question?
Absolutely.
Lori asked a great question. So, what if, Dr. Ed, someone doesn't take any prescriptions? So they sign up for the lowest cost prescription drug plan during the annual enrollment period, which is exactly what we'd advise doing. And then they have a prescription added mid-year. That's Lori's question. Well, then you have insurance. And it is very likely that the insurance plan that you selected will provide coverage for your prescription. But if it doesn't, then our member advocate team will fight for an exception so that the medication that you and your doctor think you should receive will get covered.
Yeah, a lot of people don't realize that there's a tiering exceptions and there's coverage exceptions and obviously prior authorization. Fight, 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 fight. If you need a particular drug and they say, okay, yeah, we don't have that particular one you really like, we have this other version, and for some reason it just doesn't work for you, then you can ask for a formulary exception. And the members at the member success team at Chapter can help out with that. If your drug is tier 4, which costs a lot of money, and you want to downgrade it, upgrade it, or cheaper to tier 3, or whatever the case may be, you can ask for a tiering exception. Prior authorizations, obviously, yeah, those are the really fun ones, and y'all's team help with those as well, right?
Yes, correct. We help you wade through the system so that way you don't have to deal with the insurance company. We will fight for you on your behalf. And for a prior authorization, like Dr. Ed mentioned, it's typically a one-page form. We reach out to your doctor's insurance coordinator. We have the doctor complete that one-page form, and then we return it to the insurance company so we can fight for the prior authorization to get approved on your behalf.
Perfect, perfect. Yeah, it all shouldn't be this difficult, but unfortunately it is. But luckily we've got Ari and his team there, and the rest of our community that helps people out on a daily basis. So thank you again, Ari. You are too awesome, and we'll have you back soon, and we'll go through some more stuff. And so if you need any help, reach out to Chapter. I'll be back again tomorrow, and we'll talk about another topic. And if you got any questions, I didn't get into any Social Security type questions today in terms of retirement, survivor benefits, spouse benefits, but I'll be back on that tomorrow. So if you got any questions, make sure you join me tomorrow, and we'll get into all those. Y'all have a beautiful, beautiful night, and please, 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 please take care of each other and rest of the Chapter team. You got your work cut out for you, don't you?
Indeed. October 15th is right around the corner.
All right, you take care.